Hi, Patterson. How are you?
I'm good, Jeff. Good to see you.
Good to see you. Where are you today? We're sitting,
I'm at home here in Christchurch, New Zealand.
yeah, so we've actually got sun shining over here in Geelong, over on the other side of the ditch.
Well, last week you sent us some lovely weather. I was sitting here freezing with my beanie on, and you said it's night. It's 90 degrees or 30 degrees over there, and the next day it was nice and warm here. So thank you.
I'm glad I had something to do with it. So I think one thing we talked about last time was starting to share some stories about who we are and where we're at. And I thought that was a good place to start with you of, you know, who you are and what expertise you bring to this whole topic of health and well-being. So where did it all start for you?
Well, that's a story that goes back over 50 years. And as I came out of undergraduate school in at Humboldt State in California, I was at a cross positions between applying to become an architect.
Aha, that's right. I remember that because I was an architect. So
Right. And I was very, very dismayed at the amount of mathematics I would have had to make up to go into Cal Poly and do that study. Um, but at the same time, a friend of mine went into chiropractic and called me up because I'd done my first 2 years in university in biology. And he called, and also as a paramedic. And he said, you should look at this because, it's right up your alley. He said, you've got the science already behind you. And I said, well, what is it? And so he gave me a brief outline. I went and I interviewed a dozen chiropractors in the area where I was going to university, and some of them I didn't quite understand what they did, and the others I said, "Gosh, it's just like being a real doc without drugs, and they use nutrition, and it's kind of like they put their hands on people. This is strange. I never heard of it." So, make a long story short, I applied, got accepted, and I took a right turn into chiropractic school for another 6 years of study, which they crammed into four full time, and never looked back. So the architect never happened. And I graduated Los Angeles College of Chiropractic in 1979, December 16th, with a license to print money, as they say. Of course, chiropractors, there's no hospitals or things like that. You got to go out and start your own practice. And so uh, uh, in order to take the boards in California, it's quite a process. You have to wait for the board and then you have to wait for the results of the board. And it would have taken about 9 months for me to know if I'd passed the exam and have my license to print money, so to speak. But in the great state of Colorado, I could graduate on December 16th, take the boards on January 3rd, and know by January 10th if I'd passed. So they had their act together, and I went over there in the middle of winter in my little Jeep with my tent trailer, and took the boards. And very difficult. My partner at the time, Marcia, we we passed, but only about 48% of the people who took that exam passed. So we were very happy. And I think that was the only time I've ever had a migraine was coming down off of that test.
This
But so
private practice actually got a different spin in the US compared to, say, Australia. Like it was considered to be very alternative here. And whereas in the US, you had a really strong education component because you effectively studied for almost the same length of time or same depth as a doctor. Is that correct?
well, actually, all the same courses except pharmacology and surgery, and with those are stipulated in our uh, regulations in the state of California. So, uh, quite extensive. We are primary healthcare physicians there. If I miss that tumor or lump and bump on your physical exam before I administer care, it's on me, and they're going to own my house. So we were taught to those standards. My school was accredited by the same school that by the same agencies that accredit any other medical school like UCLA or USC or Stanford. So we had a very good education, and we were literally graduated to be paranoid as hell. Is that we better not miss anything.
Yeah, yeah. So was diet part of it back then?
Absolutely. We had a brilliant course in the biochemistry of nutrition. And but the interesting thing is, as I say in my book, the things that were most significant in my education wasn't the curriculum, which was pretty meaty, but was the weekend courses that we were getting in applied kinesiology and holistic healthcare and nutrition and things like that. I mean, you have drug reps that go to the schools and start talking to the students. We had nutrition reps that came in and started talking about diet, supplementation, ideas about where the possible causes of problems came from, and what we could do about it using nutrition, using diet, using stress reduction, all these things which ended up 20 years later being the precursors of what we call lifestyle medicine now. So
Mm.
at a
And
very
that's also
early,
where a doctor splits off one way and tends to go down the drug path, whereas you've kind of split off the other way and gone down, what would you call them, natural medicine, lifestyle medicine, nutrition.
well, it's a very interesting thing, and there's been some lovely studies recently done. Is that over 90% of all medical doctors on day one, year one, are interested in nutrition when they go to medical school. It doesn't matter, every medical doctor will say this. By year two, there's only about 5% that are left interested.
Mm.
Okay. And two reasons for that: that curriculum's damn hard and life consuming. And number two, nutrition is de-emphasized to the popularity of pharmacy and interventional medicine.
Mm.
This is where the conversation's in. Goodhart taught us that, we have structure, uh, we have nutrition, and we have emotion. Okay. And so the psychology, the physical movement and activity, and the nutrition are the foundations of healthcare. And those were elaborated on in lifestyle medicine, the six pillars, as we split them up a little bit differently, but they're all still there. And so from day one, as I went through my curriculum in anatomy, physiology, biochemistry, pathology, parasitology, as we got through all of these courses, we were looking at them through different lenses. And those lenses allowed us to say, what is actually the cause of this?
Mm.
We take out Mrs. Fafufnik's liver in in anatomy, and we surgically remove this liver. We look at it and we feel it, and we go over to Mr. Fafufnik over there, and he's grossly overweight and he's got a fatty liver, and we see Mrs. Fafufnik's 103 and her liver, there's no fat in it at all. We go, how did this happen? You go, oh, he was an alcoholic. He was B vitamin deficient. He has gastric erosion. So we started looking and asking, this is 1976. Okay.
But that makes a lot of sense. So my presumption was you went down, say, nutrition or whatever, and they went down drugs, but it wasn't. It was actually they went down intervention or fixing problems, whereas you went down prevention and cause.
Well, the tenets of chiropractic at that time, and they still are to me, is that you are there to release the body's innate healing powers.
Yeah.
So chiropractors, they manipulate to let the spinal nerves and the central nervous system work optimally, and that helps. They promote nutrition, that helps. They promote actually sitting and talking to their patients, that helps. It was a different model from day one, and particularly that part where you actually put your hands on a patient. You have connections, you know. The first, I'll tell us a little story. I'll not make too long, but the first month in practice, I had a lady, Bertha, and Bertha came in with a sore neck. And Bertha was, well, to say she was hit twice with the ugly stick is an understatement. She was just an awkward child, but she was a middle-aged woman, a little bit overweight, and she had this pain in her neck. And I asked her, well, what did you do? So, well, I've been down the street to John, and he checked me out, and he said that that's nothing wrong with it, but it still hurts. And I said, well, okay. And I examined her, and I said, oh, I'm going to get an X-ray on this immediately. And she had a fractured cervical spine.
Whoa.
And then I re-asked her. I said, well, what did John do? He said, well, he just stood over on the other side of the room and scribbled on his clipboard and wrote me a prescription. I said, did he actually touch you and move your head around and examine you like I did? He says, oh no, he didn't do that. So I called up John. I said, John, I just saw Bertha, and she's got a fractured C-spine, and I put her in a collar. She'll be fine. It's stable. But you actually got to go out and touch your patients occasionally. We never got along.
No, I'm not surprised. So it's very much this biological approach rather than almost like a mechanical thing where we'll write scripts and we'll create machines to fix things. And it's like, oh, hang on, this healing internally seems
And
obvious.
many of my chiropractic brethren are, you've got this problem. We're going to just adjust you and let the body take care of it. And interestingly enough, chiropractic had this thing called maintenance therapy, where you saw your chiropractor on a monthly basis to get all the kinks out of your spine and stimulate your body to function better.
Yeah.
And you know what? After 50 years, I think that's a pretty good idea. It's like having a massage, but a little bit deeper. It's like it's that little extra tune up. So I look at that and I go, and it keeps your head in the game too. Preventative as opposed to responsive to mopping up the flood on the floor. So as after that, being in a small town in Colorado, Crested Butte, Colorado, a little ski area, and taking charge of a community because in Crested Butte, I was the only doctor there year round. There was a emergency doc at the base of the ski area, but I treated the population, and so we were seeing a lot of parasites, people going in the tropics, we're doing a lot of our blood works, all of those things. So we got prenatal care, postnatal care, all of this stuff. We were really the drugless docs of the area. And it was really a fascinating time. I stayed there for about 3 years in the coldest place in the central United States, and finally got back to California after that. And so,
And you got sick, didn't you? Like you had a major illness.
well, after we moved back to California and things are going gangbusters there, our clinic in La Jolla, California, beautiful house in Del Mar, we working our 60, 80 hours a week. And all of a sudden, I get the big cancer. Okay. And I have a testicle removed. And I think, well, we'll just wait and watch, see how it goes. I think you're fine. And a year goes by. I take an X-ray that I was supposed to be taking regularly, and I didn't. And I've got a chest full of tumors. I've got 18 or 20 tumors in my chest, and I've got probably, my weight had dropped 25 pounds. My resting pulse is 137. It's like, if I get the flu, I've got 2 weeks to live. Okay.
Mm.
And so that was a Tuesday. And on Thursday, I got the flu. So, and my oncologist, who was the head of oncology at Scripps at the time of their tumor board, brilliant guy, Bill, he said, we're going to start chemo today. He says, I haven't met with a board, but I know the protocol. This is, I think, what we should do. And it gave me a window of time until chemo didn't work anymore. And I still had tumors left. And that's when I had, on that process, decided to take care of myself, get involved in my own therapy, as opposed to just saying, okay, let's see what happens. No, I'm going to be part of what happens. And um, started to enact that holistic view of the world again on a much broader level in my own life.
That's really interesting for someone. like I can hear it being detached from it, but someone who is so strongly trained in their own healing gets into that situation and immediately gives all the power over to the doctor to say, do this. Was that how it was? You just were overwhelmed, or how did you?
That's an interesting point because I always consider myself part of the conversation. And there was a good example of this. After the chemotherapy kind of failed, we had a meeting of a pulmonologist, who was a lung specialist, the oncologist, and myself. And we're all sitting around the table, and the pulmonologist says, look, we can cut out half of your right lung and half of your left lung and take all these other tumors away from you. Otherwise, they're all going to come back like cotton candy, and we don't have as many salvage options after that. He says, but this is a cure. I think we got a cure here. And the oncologist said, well, I don't know. You've been kind of weird in the whole therapy. Your bloods weren't that bad, but even though you went into kidney and liver failure because of the chemo, but you know, your weight was kind of stable. You actually gained weight on chemotherapy. You did well. I says, I'm kind of like, I think we could wait and watch if we watch it very carefully on a monthly basis with a CT scan every month. Well, I was the tiebreaker. I obviously chose to not have my lungs cut out, and as the wait and watch sounded pretty good. And I didn't. A funny aside is I didn't have insurance. Okay, I was at that age. I've got the
How old were you?
36, I'm thinking I'm invincible, I'm a healthcare provider, I'm healthy, not working too long, way stressed, and probably eating too rich, even though I was towards a plant-based diet at the time. But you got to remember, I came from 11 years of university eating rice and beans to all of a sudden, making more in a week than I would in a year previously. So it's like, oh, I'm going to go out to dinner. I'm going to do this. Probably a little too high in the hog of that first, 3 or 4 or 5 years. And now we're only 6 years into practice, and I get this situation. So I I said, well, what am I gonna do with this? And I have no insurance, this and that. So I had to pay. I had to sell my Mercedes, okay, to pay for my chemotherapy. And then I had to, continue to pay for my CT scans, but I'd made a cash deal with one of the private clinics in town, and Dr. Green would take my 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 CT scan every month, and she was wonderful. And about 6 or 7 or 8 months into it, she comes out of the cubicle crying. I'm going, oh God, this doesn't sound good, right? She's crying and she goes, I've never seen this before. I said, yes, what's going on? He says, you have a normal chest.
Wow.
Just, it's gone. I can't find it anywhere. It's not there. You've cleared this stuff out. She's been an indication, but meanwhile, I've been meditating, I've been running, I've been eating well, I've been working very few hours, I've been having a complete mental shift on how to invoke my patients. I had taken responsibility for my patients. Now I gave it back to them. I said, no, you got to heal yourself. I'm going to point you in the right direction. So big changes had occurred in my life. But again, I've been trying to sell my practice, try to sell my practice. Finally, we get a hook, a fish on the line, and old Walter bought the practice, and the rest was history. I ended up in Christchurch.
Wow. So what over what period of time was that? Was that like from when you were diagnosed to?
It took about a year and a half to get here.
Yeah. Yeah.
Because I just couldn't sell the practice. I was just about ready to walk away from it and come anyway. Because
Oh,
I
I mean more about your illness from the day you were diagnosed to the day she shows you the scan to say that it's clear. How long was that?
Oh, that's a good question. I think it would have been, probably about 18, 20 months, something like that,
Mm.
from diagnosis to that point. And Arthur Lydiard and I became good friends by reading his book. In that I started running in the LSD, long slow distance uh, school camp,
Mm.
because that was something that felt important to me. And but the consensus was that this is all going to come back, and you're not doing anything remarkable here, but it should come back. It's more likely going to come back. So I retired, at the age of 37 or 8 when I got here, and had a little money saved up, and sale of the practice and all that, and I didn't work for 16 years.
Oh, wow.
I didn't work for 16 years. And during that time, I did a renaissance. I took care of myself. I went to the gym, I read books, I finished, I went back to soil chemistry. I started at ground zero to say, what was the cause of happiness? Number one, what is the cause of health? Number two, and is there any way that I can give myself certainty going forward?
Mm.
Um, I got in pretty good shape after about 5 years doing karate, going to the gym, meditating, surfing, all these things that were, an active life, and in that um, was feeling really pretty good. But after about 16 years, I had come back to I was here in New Zealand, and I had moved from Nelson to Christchurch, and I'm thinking, you know, it works on me. I wonder if it's going to work on anybody else. Now, in between this time, I'd finished off a degree in anti-aging medicine and rejuvenative medicine and endocrinology. So that I did two of them actually. I did one in age management medicine, which is a different school, and I did an internship there at their clinics and in Las Vegas. Then I also did the American College of Anti-Aging Medicine. They did their boards too. So because they were the only people who were talking about hormones and things that I understood completely from my training with Good Heart and systems analysis, the way we looked at the body. And they're talking about nutrition and lifestyle and also how to optimize hormones. And I said, well, I'm not going to prescribe hormones, but what these guys are talking a lot of stuff, I want to know what they know. And then when I went through the clinic in Las Vegas, Alan Mintz, the creator of the clinic, is Synergenics, and they're still a big deal in the States. He said, Patterson, he says 95% of what we do can be done with lifestyle alone.
Oh, wow.
I said, thank you. Thank you for that validation. I thought it could. And he said, yeah, so just, all of these factors. And so I came back
It's
and
just on that. Like, that is an extraordinary insight that kind of flies in the face about how most of us relate to our health and certainly the medical system.
well, Alan unfortunately passed on the gym floor doing a deadlift. He blew an aneurysm in his brain. But he looked, he's he hit it right on the head. A very bright guy, and you could, because and this is the first time I've ever done this, but if I think about what I know after my career, or where my career is at, to what he said then, and when he was my age, when he dropped dead, he's 72, I think, where he dropped dead. I'd have to back him up and say, I think 95% of everything we come into contact with as disease and pain and suffering is avoidable, reversible, or preventable.
Wow.
And I
So
think
what was that? Avoidable, preventable, reversible.
reversible. And the American College of Lifestyle Medicine, the Australasian Society, the British Society, the International Bureau of Lifestyle Medicine, all their advisors to the World Health Organization, they state that at least 80 to 90% of all chronic degenerative diseases, that means non-infectious diseases, so cancer, heart disease, diabetes, autoimmune disorders, obesity, all of these disease entities that are wiping out 95% of our population are preventable, avoidable, reversible. Okay.
Wow.
And through the tenets of lifestyle medicine, which means there's no drug, there's no serum, there's no vaccination, there's nothing. It is a behavioral issue of how we approach our lifestyle. And that's hard in the face of addiction here because we have food addiction, we have exercise addiction, we have device addiction, we have
Stress
all
addiction.
with podcast addiction, whatever. We have all kinds of different things going on in our environment that weren't here 100 years ago,
Mm.
definitely, let alone 50. So it's a phenomenal thing. And of course, during this time, when I started that renaissance in Nelson and came to New Zealand, got froze out of Christchurch because of the southerlies, moved right up to Nelson and stayed there for 8 years. When I did that, I created this renaissance of study, and I listened to my intuition saying, "Go where the passion is," because I could have been paralyzed by choice. I mean, I'm just 40. I don't have to work. I can do anything I want. I have enough money to live on. Uh, what do I do first? Okay. And so I followed the passion, the exercise, the karate, the things of that nature, the meditation, the deep Vedic scriptures, the Chinese scriptures, all of those things were really interesting. So I spent a lot of time studying. And that was the basis that started there for those 8 years, a couple hours a day minimally. And that has continued
Mm.
since that time, uh, since the early 1991, 90. Yeah,
Well,
19.
ever since I've known you, you've always done a couple of hours of study in the evenings.
Yeah,
You're
exactly.
always on seminars and webinars and stuff. That's just who you are.
Yeah, and because I find it stimulating,
Yeah.
if you're not stimulated, you're just taking up space. So
So
uh,
the fourth piece here was that you've started a new practice. So you've done all the education stuff formally. You've done your private education as well. Yes, that's still going. You've had a personal experience of the whole situation and recovered. And you've then started sharing this with patients and working with patients. So
and you know what? It worked. I was
yeah.
so busy. I was very busy, and things were ticking along. And so I started saying, well, it worked. And after 2 or 3 years, I said, I should probably start training some other professionals. So I created a whole curriculum, a 12-part series. And I made the International Academy of Prevention, Performance, and Longevity. Okay, the IAPPL. And I started training. I started lecturing again, and it was great. But I kept hearing about this lifestyle medicine group in the States. And and so this would have been 2006, 7, 8, that area. And they had started about 2004 at Harvard with six great people in that group, and formulated their strategy on how to develop lifestyle medicine. Well, by about 2015, they were really making inroads. They were having good publications. They were getting an evidence-based curriculum around what they were doing. They had approached something as simple as changing the course of medicine into not changing the course of medicine, but changing the course of behavior of patients on how they engaged in their health,
Mm.
which took it away from a threatening model, which mine was, okay, we're going to solve all your problems. Just stop what you're doing. And
Just a tweak.
that was my naivete, right? But these guys are much brighter, that's for sure. And they had attracted us. So by 2016, I'd signed up for their curriculum. I'd let mine fall off the back burner, and said, look, this is the 800-pound gorilla in the room. I've got to go with these guys. So I was all in. I went through their courses, and they took a look at my credentials. They took a look at my course, and I passed my boards, and I became a fellow of the Australasian Society of Lifestyle Medicine. Uh, and that was a great honor for me because I was the first chiropractor to do that, as far as I know.
The first in New Zealand or Australasia, something like that, wasn't
First in New Zealand. There was one or two others in the States, only one or two
it?
who had credentialed about the same time. And that was fun. Now there's scores of them, but there's about probably 400 or 500 specialists in my field in the U.S. and Australasia. But the interesting thing is that now my credentials as a fellow can be had through any many medical schools in the United States and one in Australia as a full-on residency where you can
Wow.
do a 2-year certification in my specialty. And so I think that that's just phenomenal that it's actually on the board, but it's because it's based at behavioral change and better outcomes. And
Mm.
so as we go through, like I'm just in the process with a strategy group of writing up all the major benefits of lifestyle medicine. And here's where they're different now. We think of lifestyle medicine as empowering you, the individual, to take a better position in your own healthcare team, like maybe the lead, okay? But the American College of Lifestyle Medicine has identified that lifestyle medicine is not only there for the individual, but is going to be pretty much the savior of the business community by having healthier, more functional employees.
Mm.
And now they're really fostering the in-house educational systems for industry in the United States too. And I think that's a broad conversation to have. And it's again, it strikes more at that prevention, support, and intervention uh, uh, aspect of what's supposed to be done. You want an employer to be kind of like the benevolent parent that takes care of you, and in many places that's not happening. Employees are just cheap fodder until they're burnt out and they're replaced. And the companies that have that 500-year vision of how to make a great company, we're one of those people's on our advisory board. So and they have a great company, so that it can be done. It can be done.
So, how long have you been in practice for, and how many people would you have worked with?
That's a great question. I've been in practice.
So, you had your chiropractic business for 6 or 7 years until you became unwell.
Well, yeah, roughly 10 years by the time I got out of after school. So
And
10
then you
years,
started again in New Zealand practicing.
yeah, about 16 years after I came to New Zealand. So 2005, 2006. So I got here in 89. So that was about it. And so over that time, I've literally seen thousands of patients. But in this, the interesting thing is as it evolves, being as eclectic as I am, because I'm probably not too focused, it's like,
I think it's an eclectic field. Like
well,
if you were
it
too
is.
narrow, you'd miss the whole subject here because lifestyle is eclectic.
It is. It is. And but we get to go down these little rabbit holes, which are just so fun, so much fun. But as we look at that, the latter aspect of what's happening is that we knew that a plant-based diet was where you had to go for if you wanted to get really sick people stabilized and on a road to recovery more effectively. And so the more and more the literature came out, it kept promoting and by the evidence-based science that probably the vegan diet was the best way to go when these people got that far along the path of ill health. And so I was prescribing for the last 10 years more plant-based, more plant-based, more veganish until finally about 5 or 6 years ago, I said, we just got to try this ourselves to be absolutely all in. We were pretty much in, but we had to go all in. And I went vegan. And um, you know, here I am at 72, and I was just looking at my Strava times on my local hill here, and I'm in the top 10. I was actually number 4 yesterday of all time for any age group on this,
Wow.
mile and kilometer and a half technical section. And it's not because I think I'm that good. I've only been riding mountain bikes for 10, 11 years, but it's like um, it seems easy to me because my health is good. You know,
Mm.
I do my 400 to 600 minutes of exercise a week. I eat my plant-based diet. I'm not stressed. I don't overwork. I have a good social connection to my friends. Uh, I have a little nip of wine now and then and a good zero alcohol beer and now and then, and I socialize and life is good. I think that I've got a good garden growing. A lot of my food comes out of that. And, so I think I kind of practice what I preach. And that is, I think, the only credibility I need, you know, you know.
Yeah. Well, yeah, as I said, I think you've got the four pillars in there. It's like you've got that formal education, you've got the other, your personal learning, you've had your personal experience, plus you've been a practitioner with clients. And I think that is the test. If you can't take that and then apply that to your own life and be happy and healthy, then it's kind of not a very good advertisement. You don't go and work out with the fat trainer at the gym, do you? You work out the one that looks like you want to look like. And that's why I think you were such a great example of it. It's like, wow, if I could be like Patterson in another 10 years or so, I'd be pretty happy with that. So
Mm.
that's that role modeling is such a crucial thing here.
Well, and I think, as you've always said, being the ideas architect that you are, is that you got to own your own guru-ness, right? Like who you are and what you do. And I think as I mature into that, and particularly in the 70s, they're not for sissies. It's like I'm beginning to realize just how unique that is.
Mm.
And the most important thing is that what we've discovered in the last 5 years. Not only have we discovered that, yeah, veganism isn't for everybody and doesn't need to be. You don't have to be completely vegan, but you need to be pretty much dedicated to plant-based uh, to get the benefits. But we started this thing with fasting,
Mm.
and we just got into it because we'd had friends who had been to places and had studied. And oddly enough, when I sold my practice in Colorado in 1983, Norm, the guy that bought the practice, he had been the head doctor at a fasting clinic in Texas. Like, and
Way
so
back
I
then.
learned all about it then, in one ear and out the other. I knew the physiology, I understood it. And then fast forward another 35 years, right? Or whatever. And all of a sudden we started realizing this. And as I read the research and I took a deep dive into that, I knew all the authors, and I kind of knew it in the anti-aging arena, because anti-aging, when you fast, you prolong life. And that's how it had been through yeast and mice and worms and all these things. And it's like, but now the human trials are starting to show up and saying, actually, there's other things that can happen too. We're actually reversing these conditions like diabetes. We're actually, and so now we know, when you lower your cortisol, your stress levels, when you lower your insulin from a better diet, when you increase your insulin sensitivity, when you burn the fat out of your liver from your fatty liver, when you do all of these things, what that does is it reduces all the things that are necessary to have chronic degenerative disease.
Mm.
So it's like, oh, you just put a line through 14 of the 15 causes of death. Like, and but it's not really the 14 of the 15. The number 3 cause of death, of course, is doctors.
Well, I've
So,
heard the best place to get an illness is, or an infection is go to a hospital.
yeah, and unfortunate, but it's a dangerous job. It's a
Mm,
dangerous job. The medications, procedures are dangerous,
yeah.
and so there's going to be a statistical hit there. But the audit, it's just always funny that they're left off the list. Okay. Mm. So that's that. So that in a synopsis, I'd say that my life has prepared me, as my Buddhist monk told me. He said, look at your life like you're writing a book and do the outline of what you've done, and that will tell you what you need to do.
Yeah.
So I was well prepared through trials and error and academics to step up and just be who I am, which is healthy and happy, and try to relate that to other people as we move along. Now, um, my as I move back from patient contact a little bit, and I go more into writing and lecturing and doing those types of things and things like we're doing, trying to educate people. It's like that has a broader canvas, and I think that's kind of like the bigger strategy here because I was trained in a non-digital time. I had literally uh, 700 kilos of textbooks. Okay. So and now I, I haven't picked up a textbook in a long time. I've got 6 or 700,000 papers in there available. You know,
Well, that's the thing. It's not a lack of knowledge anymore. It's or a lack of access to knowledge. It's actually putting it all together.
Great tool. Okay, you just put the phone on it and put your earphones on and instant classroom.
Yeah.
Job done.
But you also need the curiosity and the resilience to stick at it and put it together. There's a lot of separate pieces out there, and you've got to sort through and be able to come up with a, dare I say it, a digestible plan.
Something I never really thought about, and that this kind of alludes to, is that I did have a 16-year hiatus. When I came back into practice, I felt like I was playing catch up because I felt my skills were rusty. And now over the last, you know, 2006, 16 to 15 years or more, my skills are back and I don't want to let them go. Okay. I
Yeah,
just I just treated a doctor this morning here at the house. Okay, somebody needed some work, needed some talent, needed some counseling, needed some input. And so I'm not going to let that go this time. Okay. And so
great.
I know from now till I hit, the next great adventure, which is without the body. And now until I hit that time, there's always going to be that involvement. So that's given. I know that I'll always have, you know, my friend. Okay. I know that I'll always have my friends like you. And that is, you know, leaves you in a place of gratitude, which again, I think has, on a quantum level and a sub-quantum level, very, very important uh, uh, spillover into how we live our life and and how well we live our life. And it doesn't matter how much money you have in the bank. I proved that when I was in practice and I held up my x-ray and saw those tumors on my chest. No matter how well off I was or how many toys I had in the garage, they were worthless. And so, uh, the worth comes from here and the gratitude for what you have. And as we move into the next day, you have to take stock of that because that's the only thing that gets you up in the morning, at
Mm.
least for me. And it allows me to say, okay, wasn't perfect yesterday. Today I was in the garden fighting with a sprinkler. It won. Okay. It's cold, but send me some hot weather. We'll be fine.
Mm. Well, that's fantastic. Thank you for sharing your journey so far, Patterson, and may the best be yet to come.
Well, I can tell you, we got some big, hairy, audacious goals. And I, you know, I used to say, and I said this through the 90s and the oh um, don't don't have goals. Do not set any goals at all because they're so limiting. You can't set a goal unless you put it in a box.
Mm.
Okay. And so if you don't have a box, you got the whole play, you got the whole play yard. Okay. So planet Earth is a very nice place, and we need to give it reverence and take care of it, and know that we're all part of it. This is the most important thing. You are not a separate being. You are part of an ecosystem. Like it or not, you will be topsoil someday, and you will be regenerated from bean sprouts to bears or whatever. You're coming back and giving that recyclable thing. This little ecosphere, this little blue planet, is self-contained, and so it will recycle everything. It's very good at that, and I really, um, I don't know, I just get excited about it when I see little examples of it every day. But you have to pause. You got to get out in nature, and you have to pause and listen. That's a fun thing. So anyway, I ramble on as usual.
You're entitled to.
Okay. Well, good to speak with you, and I can't wait till next time when we go on to some great new topics. Okay.
Yeah, pleasure talking with you, Patterson. Have a great week, and we'll talk next week.
Thank you.